Hello, I am Sarah Warnke. I am doing my journal for reflection for the end of leadership. So this semester has definitely been a learning curve. That leadership role, not necessarily new, but in the nursing setting it was. So at the beginning of the semester, we looked at emotional intelligence and looked at the things that we wanted to improve. So two of those components for me were working on conflict management as well as time management. I'm not by any means a stranger to both those topics, but those two things really are difficult for me to manage. So this semester I looked forward to learning and developing strategies to become a stronger leader in those components. So looking at that more closely, looking at conflict management, the preceptor this semester was a nurse lead on a med-surg floor at Randalia, and she really allowed me to step into the leadership role almost right off the bat. Definitely had guidance, and I felt really supported. So it was nice to see that she didn't just dictate what she wanted me to do or just tell me what she did and did everything herself. She really let me step into that role. So, on a particular night, or morning, I should say, we got a phone call from a nurse up on an extended unit where only 2 nurses and 7 patients were at. So we went up there to figure out what was going on. And a nurse and patient were having a conflict. The patient wasn't very happy, and therefore the nurse decided that the nurse lead should come up. So we went up. We talked to the nurse, got her perspective on what was going on, and my nurse lead asked me if I would go in and talk with the patient. So I did. I was really nervous. There was a conflict going on. Wasn't sure I could handle it, but I dived in. I talked with the patient, got her perspective on what was going on, and I just did what I thought was best. I used fidelity, and said we'll switch nurses on the floor. We'll get you the things that she said she was needing, and I exited the room. And the nurse lead was listening at the doorway, unbeknownst to me, and it was really neat to see the support. She said I handled it well. We got the conflict resolved. We switched nurses for that patient care. So it was nice to go in and see how the conflict was resolved. I don't know that everybody was 100% happy at the very end, but the patient was happy. So that was what we were going for. I think that maybe feelings and the relationship with the nurse and the patient weren't resolved, but a better outcome was made by the choices that we used. Time management was also another factor. This has always been a thing for me, and I think it's always one of my goals to work better on. So in addition to managing this nursing, leadership, clinical, and all the other classes and work and family life, I've always find like I'm juggling and doing things out of order than what they need to be doing. And so my preceptor taught me, make a schedule, what you need to get done, when it needs to get done by, and set those deadlines. And it made clinical work so much better that we got report first thing and we set the schedule out of what we were going to do when. And granted, we had things that popped in, but with that schedule, it was easier to get everything done during the day. And that's definitely something I'm going to carry on and continue doing outside of nursing as well as inside. Two of the CUSIN personal growth things that I feel like I worked well in, obviously quality improvement. We had that big plan project. It was nice to meet with management and identify the area that they felt needed improved on the floor, and we collected survey data and used that to implement the education and knowledge to the nurses. it was nice to have that plan come together and get it out there. And evidence-based practice also goes with that. So finding the research for that plan, what was best for the patient as well as the nurses. Evidence-based also worked on the floor between making sure hand hygiene was getting done, protective equipment was being used properly. So it was nice to be able to set that lead example of, well, I'm the nursing student and I'm putting it on. So even if I'm just going on there to do rounds. So hopefully more of the nurses, even if they're just popping in, will do the correct wear. For the QI project, it was interesting when we put that plan in place and did the education, how many nurses were like older nurses, seasoned veterans, who were kind of like, I don't know if this is going to work. We've tried it in the past. Really weary to change. However, there were a large number of newer nurses on the floor, and it was nice to see that they were ready to implement and liked the ideas that we were putting in place. So that support was nice to see that us as student nurses could influence the nurses on the floor. 3 outcomes from the class that I think I have met. So using my ethical behaviors and being professional, definitely using fidelity and beneficence daily when I was in there, doing rounds, checking on them, making sure that the patients had what they needed, being truthful that, I don't know, the doctor gets to make those calls, or I'm going to check with your nurse and I'm going to have her get in here to talk to you, and then following through. So I was keeping my word and having fidelity and doing what was best for the patient. I was using my own leadership skills and using it to teach and reflect. That's what this lovely reflection shows, that I'm able to use technology and reflect on the semester as a whole. And then another one was also achievement of learning outcomes through reflection. This video, as well as the 3 written reflections, meet that criteria for this semester. 2 clinical experiences that were very beneficial were obviously the conflict management experience that was new, and I really enjoyed that learning experience, as well as we had a patient on the floor who came up from ICU, and the nurse who got that assignment was really leery. The patient wasn't doing well respiratory wise, and I learned that getting the respiratory therapy team on call, the rapid response nurse involved and know what's going on, we're concerned with this patient, made for quick response when things went downhill quickly. So we were able to get the doctor in and make calls to benefit that patient. They were later transferred out to PRMC in an ICU bed because things had dropped, but we were able to stabilize her before she got worse. So that was definitely a learning experience to get things rolling quickly. This semester definitely learned to use time management. That was one of my goals I expressed on the orientation night, and really understanding what that leadership role as a nurse lead was. I didn't understand prior. I hadn't really seen them in action, and being with that nurse lead gave me that understanding, and I learned a lot this semester.